My name is SeanAlfaroDiedrich, and I will be presenting acquired immunodeficiency syndrome, otherwise known as AIDS. At a glance, HIV, or human immunodeficiency virus, is a virus that just attacks the immune system, specifically CD4 T cells, which are crucial for immune defense. When one has HIV, the virus gradually destroys these cells, leading to a greatly weakened immune system. HIV progresses into AIDS, and AIDS is that final stage of HIV infection. Not everybody who has HIV will develop AIDS, especially if they have proper treatment, but the hallmark of AIDS is that you'll have a severely compromised immune system, which leaves an individual compromised to or vulnerable to, infections and viruses that otherwise in themselves or healthy individuals wouldn't pose that great of a risk. However, if you have HIV or AIDS, then these um, more or lesser serious diseases that we think of or whatnot become very serious and even life-threatening. And so what that has led to since the 80s is 40 plus million lives claimed, including 1.5 million children. And the thing is, you can't get over it. It's a lifelong infection, so that immune system is compromised for the rest of your life if you do contract HIV or AIDS. So it's a very serious disease that, well, can be prevented. And we'll go over some risk factors to start to think about that. The main one is sexual activity, unprotected. If you're having unprotected sex, that's going to be a huge risk factor as HIV is transmitted primarily through body fluids, blood, semen, vaginal fluids, and even breast milk. So if an individual has a very high sexual activity and they don't practice safe sex, then they will be greatly vulnerable to contracting it. So it's something to think about. Transmission can also occur with sharing needles in a mother to child situation and exposure to blood, generally speaking. So again, bodily fluids are going to be your risk factors there, and that main one being unprotected sex. Current knowledge and treatment. When it comes to nutritional guidelines and preventing and treating, and it's mainly just about bolstering the immune system across the board because you're stuck with this and you just have to work with it and bolster your immune system as best as you can to mitigate or offset the symptoms that HIV/AIDS causes. So in doing so, you want to have proper nutrition, which includes adequate caloric intake, being as HIV/AIDS often cause unintentional weight loss and malnutrition. You want a lot of protein, as this is the macronutrient that's mainly responsible for maintaining and repairing tissues. So that is not limited to the immune system, or the immune system is no exception. And so we're definitely going to want to make sure we're having enough protein. So I have salmon pictured here because not only is it a high source, it's a good source of protein, but it also has healthy fats such as omega-3 fatty acids, which also are going to help bolster hormone production and immune health. When it comes to micronutrients, vitamins A, C, D, and E um, are going to be important. If you have any deficiencies in these, you can worsen immune function. So we're going to want to avoid that by making sure we have those. A balanced diet rich in fruits, vegetables, fortified foods can help prevent those deficiencies and hence prevent further immune worsening. When it comes to preventing and treating, the main treatment are antiretroviral therapy drugs. I have pictured on the right here. Really, adherence to art, or it's art in short, adherence to art helps lower the viral load to undetectable levels, which not only prevents the progression to AIDS from HIV, but also reduces the risk of transmitting HIV to others. Regular physical activity, generally bolsters the immune system, so we're going to want to continue to do that and have exercise. So No matter what that be, just get out there, do what you got to do to combat fatigue and stress. And I know I already talked about safe sex, but really, again, have to emphasize that using condoms or something of that nature consistently during sexual activity is really going to make a difference as you limit that transition, that chance of transmission. You can reduce the number of sexual partners, get regularly tested, and or just completely abstain. No going wrong with that. Um, so yeah, just practicing safe sex is really going to go a long way to prevent AIDS and stress management. If you are stressed, we know this can weaken the immune system, which makes it generally harder for the body to fight any infections, and such as the case, especially with a disease of this nature. So practice such as mindfulness and meditation, whatever brings an individual peace or helps them to relieve stress is going to be very helpful for them. So they just got to understand, themselves and what they need to do, what they should do, what they shouldn't, and just how to basically, um, you know, they're keeping their body okay when it comes to nutrition and exercise, but also the mind is a huge factor, and limiting that stress is going to go a long way as well. And so all these put together are going to bolster the immune system as much as you can. Because once you have this, you just have to live with it and, bolstering the immune system as much as you can. And stress management is going to be another key, another part to that. And here are my references. Thank you for listening.